Welcome everybody. Today I'm going to discuss 4 muscles that are in the neck that is causing a lot of our symptoms, tension headaches, jaw problems, ear problems. These are the 3 particular things that are the biggest issue for a lot of us here. And we're going to look at our diagram. We're going to look at the example here on the screen, and we're going to see these 4 muscles. Let me zoom in just a little closer here. And you're going to see that these 4 muscles located right here. Let me just turn it back. 1, 2, 3, and 4. All 4 of these muscles are called the suboccipital region, and these are the 4 muscles that control the movement of our neck going back, going forward. And what the problem is over time is that because of forward head posture, because of just bad posture in general, looking down at our cell phone, typing on our keyboard, sitting at our desk for 8+ hours a day, these 4 muscles right here, if you're looking at it from this angle, are going to start getting inflamed over time. They're going to start tightening up and shortening. This is causing a lot of the issues with the ear pressure. This is causing a lot of issues with just neck tension. Sinus problems start to come up with this because of the tight nag and the fact that we're not taking time to stretch our neck. And this is giving us all these funky symptoms. It's called referred pain. And what's happening is that these muscles become so tense that you start developing so many issues in your ears. You start developing so many issues with tension headaches. A lot of you are dealing with tension headaches, dizziness. Dizziness is a big issue that happens when you're dealing with these muscles here in the region of the jaw area, the back of the neck. Now, if I dig a little bit here, let me just show you what it would look like from a skeletal point, or muscle point of view here. So there you go. Right in this area, we're not taking time to adequately stretch our neck. We need to seriously, these muscles here control a lot of our movement. And over time, they become so tense that we start to we're not certain where this pain, where these symptoms are coming from. So what I wanted to explain to you is there's some things that you can do to start really loosening those muscles up. And what really the biggest thing is, once those muscles become very loose, you'll start to lose a lot of the sensation of the problems in the ears. They're all directly correlated. Just taking time to stretch your neck, going back, going to the side, chin tucks is a huge one. What I can also do is put some slides on the screen here, and I'll start cycling through them. And that way you can see exactly how important it is to keep these muscles right here, to keep these muscles loose over time, so that way you can start healing and feeling better, because this is a lot of what's causing the problem. The suboccipital region, these 4 muscles are not always talked about, but I'm telling you right here, right now, your ear troubles, your jaw troubles, your tension headaches, tension in even the lower back up to the region right here around the suboccipital, has a lot to do with these muscles right here. These 4 muscles are going to be the cause of that. So we're going to go ahead and put some slides on the screen, and I'm going to discuss how these can really loosen up that area for you, so you can start healing and feeling much better. Okay, so let's pull up some of the slides here. As you can see, this is going to be a great stretch. This is going to stretch those 4 muscles we talked about: the rectus capitis posterior major, the rectus capitis posterior minor, obliquus. These are going to help really stretch those 4 muscles out, the inferior and the superior. And you'll really start to notice a lot of changes in the neck region as well as in the ears. It's going to start loosening up the jaw muscles as well, because you can see where the position is of this cushion here. This is designed to support the neck, and the natural curvature of the neck is going to be well supported using this little piece of device here. This little pillow here is going to be really beneficial for you. So I recommend doing so, laying down on a cushion like this, and I can put it in the description, a cushion that's going to help support this natural curvature, so that way you can start finding that healing again. All right, next we have the straight foam roller. This is going to help as well with positioning and keeping the body aligned. This doesn't have the natural curvature like the foam pillow or the cushion has, but this is going to help keep the body straight, aligned. That neck needs to be propped up. I recommend during this position here, when you have the roller tucked away back there, is to start doing some breathing exercises. It's going to keep the blood moving around. It's going to help with anxiety, toning down some of the stress levels, and keeping you in a good alignment. So I thoroughly recommend. This kind of goes with step one, but this is going to be very helpful and a really important tool to have. Talk about the easiest stretch of the day. Now, this is going to help tremendously with shoulder tightness, tightness in the neck. This is going to open up those shoulders and really help you feel good. It's not the easiest of stretches to do, especially if you're dealing with pain and tension and you're having a lot of stiffness in the neck. So you want to be very cautious when doing this stretch, but this is going to help you feel so much better, opening up those shoulder muscles, stretching them out. That's going to benefit your neck. It's going to benefit the joints. It's going to benefit the 4 muscles we talked about. So doing this often is going to help with headaches, tension headaches. I don't recommend doing this in the middle of your bout with a headache, but you do want to implement this stretch as much as possible throughout your day. Keep your back opened up, keep your shoulders opened up, and you'll start seeing benefits in your jaw and neck area as well. Again, this is important. We have to keep our shoulders opened up. We have to keep the deltoids moving. We have to keep the shoulders not so stiff, because that stiffness in the shoulders, the joints, the back, it's going to just travel upward. It's going to go upward into the neck. Then from the neck, it's going to go upward into the jaw. All caused primarily by stress and poor posture. Keeping the shoulders, as you can see, the red arrows indicate the movement, the rounding of the shoulders moving around. You're basically going upward, back, and around into a circle motion. This helps a lot with posture, help loosen you up. Again, it's not targeting the jaw, but it affects the jaw. So you're keeping those shoulders open. It's going to keep your neck loose, which then is going to keep your jaw loose, which is going to keep so many things working for you. And I have seen this help with anxiety, depression. Just staying loose is going to help with all the other symptoms that you're dealing with. And this is definitely not a new photo. Those of you that have been following me for quite some time, you know how important neck stretching is. I emphasize it every time I can. This is going to be good to keep those 4 muscles in the back, suboccipital region muscles, opened up. You see how the red indicates where some of that tightness is coming from, going all the way down to the mid-back, close to the shoulder. So doing this often is going to help tremendously. And I posted a video about a few weeks ago about how important towels can be. They are very effective with the suboccipital region. Placing that towel just slightly beneath the skull, right above the neck there, right on top of the shoulders, is going to help you. What you do is you just add a little pressure, not much, and you lean your head back. That's going to help give you a good stretch, lift your chin upward while still holding your position with the towel, as you can see the woman in the first example, and then going forward and then going back. That motion is going to help exercise those muscles, keep them nice and loose, which is going to benefit your jaw muscles, which is going to benefit your shoulders, is going to benefit your posture entirely. I threw this picture in here because this is what helped me. Now, if you're dealing with severe pain in the neck and shoulders, please refrain from doing this particular stretch, this exercise. But if you're not dealing with pain, just a little bit of stiffness and tightness in the neck, this is going to help you. Place a towel and roll it several times. Place it on the edge of the table. Now, this is going to have to be done with care. If you're not comfortable doing this, be sure to be in touch with your doctor. But if you are comfortable to do this, go ahead and practice this method. I did this. This has opened me up completely. I felt really good after I did this. But you don't want to stay in that position very long. I would say maybe about 15 seconds, maybe no less, maybe 10 seconds, 15 seconds or so. And you'll get a good stretch doing that. But of course, again, folks, if you're feeling some extreme problems in your neck, refrain from this position. Just wanted to give you another example of how the shoulders are affecting the neck, which affect the ears and jaw. You're going to hear that a lot. So this is just taking your arm and pulling on it very lightly. And you'll see that that is such a simple method, simple exercise, but has very astounding results. And you're going to notice that here. And this picture that you're going to see coming up here, and in this example, you're going to take both hands, put them right over the suboccipital region, and you're going to lightly push your head down. You see where all the red is here? These are the muscles that are going to benefit from doing this stretch. And again, you just want to hold it there for about 5 seconds, lift up, go back down again, and you'll start to notice some changes in your the way you feel. Even your sinuses will start to kind of open up better. And this is going to have a lot of benefits doing this. All right, once you get to the end, I want you to get a warm towel, not too hot. Just place it where you see in this example. Just place it right over, draped over the shoulders a little bit, right in the upper to mid back, and just hold it there for about 20 minutes, and you'll start to really feel some looseness around the muscles there. And then what you can do is you can slightly raise that warm towel up just a little bit above the skull there, the suboccipital region, and then hold it there as well. Do that all within the 20-minute frame, and that's just going to keep you nice and loose. It's going to help you protect your muscles, and you'll start to notice some changes and some difference in your the physiology of your body. And just do that consistently, and you'll start feeling better.
Bye.